BRONXNET. Your voice, your views, your vision.
Pursuant to Chapter 4, Section 85, and Chapter 69, Section 2706 of the New York City Charter, a joint meeting of the Bronx Borough Service Cabinet and the Bronx Borough Board will take place on Thursday, April 14th at 9:15 a.m. The meeting will take place at 198 East 161st Street, 3rd floor, DA's Litigation Room in the Bronx. We have 5 items on the agenda, so we're going to try and move them quickly. The first one is the employment initiatives affecting New York City. There's a presentation by Raymond Singleton, who's the Assistant Deputy Commissioner for the New York City Human Resources. Good morning. Good morning. How are you? It's good to see you again. Okay, would you like to get started? Thank you. Right at the microphone. That is on, right?
Yeah.
Well, good morning. Thank you for having us and inviting us. We're welcome to be here. We always are excited to talk about our employment programs and some of the initiatives that we're doing to try to encourage people to take advantage of the labor market and get connected to private industry. With all due respect to folks that are here, on behalf of Commissioner Robert Doar from HRA and my boss, the Executive Deputy Commissioner Seth Diamond, again, want to thank you for having us. HRA's employment programs have been putting people to work for years, and so I've been employed at HRA for the last 3 years. My name is Raymond Singleton. I'm the Assistant Deputy Commissioner of HRA's FIA employment programs. What falls underneath my purview are programs that you all are probably familiar with already. And so I'll just give you somewhat of an overview of those programs and then talk to you a little bit about some of the initiatives that we're currently doing to try to push people and help people get connected to the labor market. We have 5 programs underneath HRA's FIA Employment Services. One of them is our Back to Work program, which you all probably know of and heard of. In our Back to Work program, we have 8 contracts, 7 vendors who operate these contracts throughout New York City in all boroughs. Each vendor has about 3 to 4 sites. Some vendors have more, about 10 sites. And they provide employment services for residents in each borough, in the Bronx and in Manhattan. And they connect people to the labor market by providing job readiness services up front, short-term training if people elect to go into those training programs. And then through cultivating relationships with employers, they help people network and try to get connected to the labor market. Once they've accomplished that goal of connecting people to the labor market, they then provide retention services. Those retention services include a plethora of incentives to keep people attached to the labor market and help them reconnect to the labor market should they lose their job. One of the things they offer them are transportation vouchers like Metro cards to make sure that people can continue to go to work. They also make sure that people are connected to transitional benefits so that they have child care if they're eligible for it, and they have access to food stamps if they're eligible for that at the wages that they're connecting to these jobs. In addition to that, if people fall out of those jobs, they offer them the opportunity to come back in, talk about that, and reconnect to the labor market through a rapid reemployment initiative. Some vendors even go as far as to give people incentives. So they might give them savings cards or shopping cards to go to retail stores where they might help spruce up their wardrobe and their outfits so that they can continue to work and be as business professional as possible. Those Back to Work programs are part of our driving force to connect people to the labor market. We think we do pretty good work through them. There's always room for improvement, but those programs have been a staple part of HRA's employment services for years. Besides that Back to Work program, we have a program that's overseen by a group called Team TAG. Those are our training initiatives, and so if people elect to go to a 2-year college or they want to enroll in a training program, they can decide for themselves that they want to do that, and they go to our Team TAG office. There, we have workers who see people, do an assessment, make sure that people are eligible to go to training, and then help connect them to the programs that they've already elected to go into. One of the things that we do through Team Tag, which people aren't often aware of, is we fund programs that help people stay connected so that they're eligible and they continue to be eligible for benefits while they're going through the training program. So let me give you an example of what that is. One of our vendors is required to create web programs so that when people go to college, they can continue to participate in a web program so they continue to keep their eligibility for benefits. And what happens is that if people elect to go to school, sometimes they get frustrated with the system and they wave their hand at the process, right? And so they no longer go through the rules or stick to the rules to stay engaged in the program. When that happens, sometimes people can fall into conciliation. They can get what we call FTC'd, which is when they're not complying. They then have to attend a fair hearing. They then have to go through a process where they would lose their benefits. The programs that we fund are responsible for finding people in the CUNY system. They work with CUNY educators in CUNY classrooms. And once people are determined to have already enrolled in the CUNY system, we look in our systems to see if they're still eligible for benefits. If they're not, CUNY reaches out to them, as well as this program does, to say to them, here's a web program that you can participate in that's close to home, that's geared towards what you're studying in college, so you can enroll and maintain your eligibility with HRA while you continue to pursue your degree. And so that's one of the programs that's not often talked about, but it's what we do, and we've been doing it for years, again, underneath our Team Tag program. So that program, again, helps people who want to enroll in two-year colleges or short-term training programs, and it helps them through the process to stay engaged and eligible so they continue to get their benefits. Another program we manage is called BEGIN. That acronym stands for Begin Education, Gain Independence Now. That program has been around for years, and that is our literacy program. So for people who have not acquired a GED or a high school diploma, or if they're operating at a low level for language proficiency, we will enroll people into BEGIN. BEGIN will work with people for close to a year to help them increase their language proficiency, help them make educational gains so that they can connect to a pre-GED program or a GED program so they can take the test, get a GED, and then hopefully compete in the labor market for better jobs. We've worked very closely with BEGIN. BEGIN has done some other nuanced programs where they've created these industry-specific programs and coupled the literacy training and the language proficiency training with industry-specific training so people can get credentials for the food industry, for the health industry, for the transportation industry. So then people can continue to work towards their GED goals while they're engaged in these training programs to get to a part of the labor market where we know that people with low academic levels can connect, be successful, and continue to work for decent wages on top of that. In addition to the BEGIN program, we have our Business Link operation, which is a way that we cultivate relationships with employers. So HRA stays in the ring, even though we have vendors who connect people to employment. Business Link, and some of you are probably on our fax list through Business Link, we send out faxes throughout the city informing people about hot jobs that we currently have. And so if people are, again, eligible for benefits and they're seeking employment, they can go straight to Business Link, which is on 34th Street, go into a hiring session, compete for jobs that we're offering, and then land those jobs and continue to go forward. And then finally, we have our Welfare to Work program, where we've been connecting with DHS and working with staff there to try to target and customize services for people who are in homeless shelters. So we work specifically with the over 200 shelters in New York City to try to customize services, employment services on site at each shelter in New York City so that we can motivate people, work with their staff to immerse them into an employment culture, and help people get connected to the programs that we currently have at HRA, but then other programs throughout the city as well. Small Business Services Workforce One centers do a great job at providing services and connecting people to work. We make referrals through that process to the Workforce One Center, and we're looking for ways that we can work closer with them to try to help, especially that population in shelter, be more successful connecting to work so that they can become eligible for the rent subsidies through the Work Advantage program. And so you know about our Parks program. We do a great job of subsidizing employment and putting thousands of people to work monthly in our Parks program where they learn maintenance, horticulture, arboriculture, and work closely with the Parks Department to either gain employment there or gain employment in the private industry where they can use their transferable skills to be successful. And so that's our programs underneath our Employment Services division. And to give you some, just a little bit of information about our new initiatives, back in October, HRA had We've been awarded about $25 million to work with private industry and in the public sector to create wage subsidized programs where we could immediately help people connect to jobs without delay, without too much of a process of going through job readiness training. That wage subsidy period would be the job readiness component for people to get ready for work. And so we created an HRA JTP program, which we're very proud of, which we're taking people and hiring them at HRA and all of our buildings and making sure that people are being closely supervised, that they're learning in a work environment that's professional and supportive and gets people acclimated to the rigors of getting up in the morning, going to work, performing tasks, and being excellent workers so that when they're done there and they connect to these other unsubsidized jobs, they'll perform well. In addition to doing the HRA JTP program, where we've hired over 120 people and probably moved on close to 200 people so far, we've created great relationships with employers in New York City to subsidize the wages. So one of the things that we hope to do was to stimulate the economy, create more job opportunities, because we're telling employers that we can reduce their immediate costs for payroll, right? And so where employers are paying payroll costs, we can bring those costs down. We cap that money about $10 an hour per person. So in reality, we can give every employer an opportunity to save about $8,000, $9,000 per worker for 6 months of employment, which adds up so that employers are not spending all of that upfront money on salaries and can, in theory, hire more people to come on their payroll. And this is sort of a try it, you like it deal. So if they like what the folks are doing on the job for them, people will roll over after the subsidy period and stay in the job. And so we've tried to allay some concerns where people think this is sort of corporate charity. We're just giving money to employers. There are rules written in that employers have to follow, so they can't lay off people to bring new people on board. And in addition to that, we have a clause that says that they will make best efforts to retain at least 50% of the people that we give them through the subsidized program so that they become a part of their regular workforce. And so, these are great programs that we're putting out. We are trying some new initiatives around training, short-term training, linking those jobs to immediate employment. We certainly are cultivating relationships with employers where they'll make more of an investment in their entry-level staff. And so you'll know that some employers will invest in their managerial staff and their second-tier and third-tier staff, but their entry-level staff, they don't have a lot of job training programs or investment in that group of folks. And so we've encouraged them to do that by using some of our ITA funding that we have available to work with training providers who are based in communities, local communities, by working closer with community colleges so that we can offer workforce training for employers who might not have that cash flow to invest in people at that level. So we're open for questions if you have any.
Okay.
But that's our quick and short.
I have one, and that is, given the cuts that we're facing here in the city, are any of these programs in jeopardy, or are they going to be cut?
We haven't cut any of these programs. So we have reduced funding for some of these programs. We haven't cut services from these programs entirely. All of our programs are still operating, and in line with the city's thoughts and requests to streamline services and become more efficient. We've done that. We've answered a round of pegs to reduce our overall expenditures, and we've proposed pegs that we thought were responsible. We could make cuts that were painful, but we could make those cuts where we could and still have programs provide services the way that we hope that they would at the standards and the quality that they do.
Right. Deputy Chief of Staff, Camilla.
Thank you for your presentation and explaining these programs, and I wish it was really that simple. But I have a couple of questions. Number one, you addressed that you deal with the community colleges. Why are they restricted when they're in the program to being a 2-year college versus a 4-year college? Because when they go to a 4-year college, then they are not eligible for the program, whereas you will want them to go to a 4-year college because, they could achieve more. So I would like that question answered. And then also with the WEP program, we had a problem with this ourselves, whereas a WEP worker will work every day, and somehow or another, someone downtown put him in as if he did not show up, and the man emptied my garbage every day. And the next thing, he was removed. So I'm trying to figure out how is that problem resolved, because it took him like months before they put him back on a WEP assignment, and it wasn't even his fault. So that's problems we're incurring with the WEP program.
Okay. So let me tackle your first concern about the time limits for education. TANF policy says that people have a 12-month limit, lifetime limit, to enrolling in training, short-term training, colleges, or whatever. And so I think people have to make conscious decisions about how they spend that time coming into the programs. There's also regulations that we follow that say that people can't enroll in a 4-year college, that they can only enroll in a 2-year college, and so we're held to those standards. Okay. However, what people can do, right, if they get a job and they go to work, they can, like I did and maybe like other people have, make a way for themselves to work and go to school. And so we've tried to promote learning as a lifelong task, right? And so instead of people thinking in terms of, let me stop everything that I'm doing, go to college, go to school, and take the time that I need to do that, we've been trying to encourage people who may not have that opportunity to go to work, get a part-time job, get a job, right, where they don't have to satisfy the TANF regulations and requirements for participating in a WEP program or a mandated program, where they can be free of that because they're working. Right? And if they're working, then they can decide that they can go to college part-time. If you think about it, it's only the same thing that they're currently doing, right? So if they're in a WEP program and they're attending college, they're still splitting their time. The only difference is now they're going to work, right? And they're working in a part-time program or in a work environment that's giving them allowing them the opportunity to attend college at night and on weekends. And while I have that moment, I'll tell you, we developed a program with a training provider, and what we tried to do was impress upon people that they may have to work on weekends, even though they have children, and work at night to continue to train for second-tier opportunities in the health field. And we asked a training provider to change their hours and customize their hours for weekends and nights, and they did that. And we told people up front that if we're going to put you in a subsidized job, you have to make a commitment to go to school at night and on weekends. So we can attach you very quickly to jobs as home health aides, right, because those are abundant. But the wage is low. But attaching people to jobs as medical assistants, where those wages could pay up to $24,000 a year with benefits in a hospital or in a doctor's office, people have to have a skill set to do that and get a credential. It might take them 6 months to do it. And so we tried it out just to see if people would be successful, but we put them to work in a full-time wage subsidy program, and then we asked them to make a commitment to continue the training. And so far, we've had incredible attendance. This is probably one of the more popular programs that we ran in the wage subsidized initiative, and people have still been operating this program. So we haven't seen the outcomes yet. I think around August, we'll probably see that first wave of people in their wage subsidized program. We'll see how many people completed the course. We have jobs lined up for them that we hope they can compete for and be successful at. But we'll see what happens. I say all that to say, part of the encouragement is to encourage people to try to juggle their lives and do 2 things at one time, right, or 3. Cope with everything that comes up, take care of their family lives, go to school so that they can increase their education level and work, right? And so that's a lot to manage, but I did it and other people might have done it as well, right? And so to your second point about the gentleman in the WEP, all kind of things happen when people are engaged in these programs. Sometimes sometimes it's on the fault of the customer, sometimes it's a technical issue, sometimes it's a glitch. And so I don't know exactly what happened with this person. Sounds like they're back in business, but if they're not, you could certainly talk to me about this person, give me their information, and we would look it up and try to address whatever went wrong for them.
Xavier?
Good morning, Commissioner. Good
morning.
Presentation. But I'm looking for some actual numbers. For example, I'd just like to know in terms of the Bronx population that's on public assistance and how many of the participants that are in these programs in terms of breakdown that are actually in these training programs, and how many have you been able to get actual jobs for, and what the retention rates are exactly?
Okay. We have a few programs in the Bronx, and we can follow up with you on exact numbers. If you sent me an email and tell me what exactly you're looking for, we can give you those numbers. But I can give you off the top of my head the programs that are in the Bronx. So Goodwill, which runs a program right around the corner, probably sees the bulk of the people in the Bronx for HRA. Since they've started their contract, I think we've referred to them about 147,000 people. Of that number, maybe 80,000 people have actually enrolled, which means they've stayed in the program, they've got an assessment, and they've continued to go through the process to get a job. I have that number, and I'll tell you what that is, because I figured somebody would ask. To date, Goodwill has been successful placing over 11,000 people in the jobs, 11,665 people. And we have milestones in our programs that we think that our programs ought to be successful, placing at least 1 out of every 4 people that come in the door. And their percentage is over 25%, 27% of the people who come in, they place. And so that's a count of people who they can actually put in the system and claim credit for at the 30-day mark. Now, you have to understand that when the vendors are working, we don't pay them. They all work on performance-based contracts. So we think that's a wise way to utilize city dollars, right? There's no waste there. And we don't pay them unless somebody has stayed on the job for 30 days. So after somebody's been in a job for 30 days, we think that's relatively stable employment for somebody just entering the labor market. And so you have to imagine that then what Goodwill is not reporting to us in that number are the number of people they connected to day one placements who haven't stayed in those jobs, right? And I can go through the list of reasons and stories about people who fall off the job within day one, get a job, the employer says, I'm going to hire you, and then they don't make it past the first week. All of those people who they connected to jobs, you know, we can't talk about that number because we don't know what that number is. We only count the number of people who stayed on the job for 30 days. And we know that most of our vendors have performed over 25% with the numbers of the people that have actually enrolled in the program, stayed, and got an assessment. And so in the Bronx, you've got Goodwill, you've got Seedco. Seedco works with, used to work with Phipps Houses, works with Catholic Charities, works with CAB, and works with vendors like that. You also have FEGS, who's one of our Bronx vendors. And all of those vendors work together to provide services. Then you have Arbor, who provides services just for the homeless population, and that includes some people who live in the Bronx as well.
So is this program mandatory? You know,
Yes.
The client, and are the, I don't know what the percentages are in terms of, like my community, but we're a young population, and we have a POISE program.
Yes, you talked about the POISE program last time, and I gave them your hoorahs for them.
Right. So I'm trying to just kind of get an assessment. Who's taking? Well, it's mandatory, but are the young people being forced to join these programs? And
So,
what the percentage rate is?
Part of the thing that we could probably do better is try to customize services for populations. We don't do that now, right? When youth come in and they look for services, they get served pretty much like everybody else does across the board. Our Parks program has a particular program for youth that they carve out, right? And POISE program that you're talking about really focuses on women who are pregnant past 8 months, then tries to help them go through that process and then connect to employment, and then deal with all the maternal issues that might come up afterwards. We don't separate employment services for youth or for adults. When people come in, they get served the same in our programs, and maybe that's something we could think about, because youth and we know black men and Latino men are having a very difficult time in the labor market. Formerly incarcerated folks having a very difficult time in the labor market. The unemployment rate for them has ballooned well beyond what I think is even reasonable to accept. And so I think we should look into how we serve them better. Right now, to answer your question, we serve everybody the same. People don't get served differently when they come in to these programs.
But you're going to get those numbers for me.
You send me an email, I'll get you those numbers.
Yes.
I just have one question regarding the individuals that are in the web program and go to college in the evenings. Are there any provisions for babysitting fees in the evening?
We will allow for off-hour childcare, but people have to request it, and it's not something that's done routinely or just as a regular part of the process. But people can get off-hour childcare. I think the bigger problem is not whether we would pay for it or not. It's the matter of can they find it. And so I think people have a difficult time finding formal off-hour childcare.
Because I think that's one of the biggest problems that many of these individuals have. You have to work in the day because it's mandated that you do the web.
Right.
and you're trying to get your life together to get some kind of education and a skill.
Correct.
But then there's always that obstacle that doesn't allow you, which
Correct.
makes you stay part of the system.
Correct. So I'll tell you what we've done to try to address that. There is a employer who's opened up a site near the Washington, New York City, NYCHA's Washington Development, 169th, and I know that's 3rd Avenue, Webster Avenue, right, somewhere over there. And the name of that entity is Brightside, right? So they had a ribbon cutting about maybe 4 or 5 months ago, invited some of the elected officials to come. We've been working with them to try to help them develop a workforce program, right, where they could be a staple for parents coming in, dropping off their children, posting up employment on the boards, getting an employment culture in there, and also offering off-hour care. So we've been meeting with their VP, who flies in from Pittsburgh and Philly regularly. Matter of fact, we have a meeting with them on Thursday. And their HR person who's been hiring people from our community program at a really good rate, and then also from our other programs, and putting people to work as assistant teachers. We have a special project where we're working with a training provider who will train people just for their jobs and other jobs in the industry, because those jobs fall in a part of the labor market that is what we would consider recessionary-proof jobs, right? So education and social assistance, assistant teachers going to work in child care entities have been getting jobs and producing jobs, even though the labor market has been reducing jobs, all right? So that's what we would call recessionary-proof labor market, and because it only makes sense, right? If people go to work, they need childcare. So this sort of job is a job that has this, recycling effect, right? So if parents can go to work because this entity is offering childcare, right, then more people will bring business to them because more people will need to go to work. And so we've been working with them on the premise of maybe they could offer off-hour childcare. So they not only have a site here in the Bronx, they have another one on Westchester Avenue and in Brooklyn, and they intend to open up maybe 10 more sites in New York throughout the next 2 years. So we're working with them because we want to staff their new places. We've been helping them to pay the fingerprinting fees to put people to work. We've been working with them to try to help them with the processing with ACS. And we've been trying to make sure that they're successful as much as we can, like any other employer, so that they would, certainly hire our people, but then do exactly what you're talking about, offer services where people can, take advantage of going to work and being successful.
And how successful has the city been in placing the web workers that work for the various city agencies, parks, sanitation?
We do give people
DCAS.
jobs. And to answer your question honestly, if people in the web program connected, and we could do a better job connecting them to our employment programs like Business Link and maybe even Begin and so on, people would have more success. We do have some success putting people in employment in the web programs. I don't know what those numbers are off the top of my head, but people do go to work coming out of the web program. The idea was from the very beginning that people who were in a web would be coupled with a back-to-work program. So those two programs work in tandem, right? You spend 2 days in a back-to-work program doing a job search. You spend 3 days at your work experience program. And what's supposed to happen is that work experience that you're getting at your web, you'd bring that back to your back-to-work program, and it would balance out. So your back-to-work vendor would say to you, you've got great admin skills working on this web for the last 3 months. We have this set of jobs where you could transfer those skills here and be successful. And so I think that happens to some degree, right? But certainly not to the level that we would like to see happen.
Because my experience has been from seeing individuals working that they can be there 4, 5, 6. I've known people that have been there 7, 8 years, and I think that's really a shame that we're utilizing these individuals at such a low rate, and we're not giving them any kind of opportunity to feel a need or sense of want. So
I would say to you with all integrity that I know we could do a better job there, but I would also say that I wouldn't carry all the blame. I think it's a twofold system, and it's a twofold process. Sometimes people can get comfortable, right, where they're at, and so that web program, as long as you're complying and you're showing up, your benefits stay intact, right, and you'll stay right at that level. A better example might be, for people who might apply and get Section 8. Right, they're capped at a certain level of living. They must be below $30,000. If they decide that they want to break that, they have to break that level of comfortability, right? Leave that subsidized rent alone and try to aim higher and get a job for $80,000 a year, which, is a lot more work, it's a lot more riskier, and you don't have that comfort level anymore. And so I think for people who have been in a web program for a while, it's sort of a routine, right? You get up, you show the work, and everything stays intact. And so maybe it might be a part of the process to make
What
sure
percentage
that
of individuals do we have working in the web program in city agencies? How many?
I don't know.
10,000, 20,000, 15?
There's a number, and I can get it to you again. You know, I wouldn't put that out here, so I'm not prepared to present that. But send me an email, and I'll send that number back to you.
I will.
Okay.
Jeff? Pass the mic down, please.
Thank you, Madam Deputy. Good afternoon. On behalf of Councilmember Annabelle Palmer, I know she wanted me to ask a couple of quick questions. There was a report in yesterday's Daily News about DHS going to start charging homeless people that have jobs rent.
That was in today's paper. In today's paper?
It was either yesterday's or today. But what I was going to ask is that going to, do you know if someone's in one of the programs you mentioned, would that still apply to them?
I think that the proposal on the table is that for people who come into homeless shelters and have the means to contribute to that shelter allowance, that they should. I think that's the proposal. So I think it's not a matter of whose program they're in. I think it's a matter of anybody who's in a shelter who's working and has the means to contribute towards their shelter allowance, that the city thinks that they should. And I think Deputy Mayor Linda Gibbs was quoted in the article saying that, you know, this has been a rule that's been around for a while, but the city has never enforced it, and that they're taking a look at it now to see if they think it makes sense, because they've tried a number of things in the past, and the numbers of people in shelter continue to rise. And I think they're trying to see what innovative things they can do that, you know, pushes people to get out of the shelter system, connect to housing, and then stay in that housing and be responsible towards what they have to do to stay in the labor market.
Okay. And then my second question was involving the food stamp program. You know, the past couple borough boards, and I know the mayor's been a big advocate, and many people have as well, on healthy foods and healthy nutrition. Is when people, you know, we all know that healthy food tends to cost more than less healthy food. So is there any type of, I guess, educational component to when people receive food stamps to inform them that, hey, there are, you know, even though you have a limited means, here's some supermarkets that you may be able to get cheaper but healthier food options and things of that nature? Mm-hmm. Is there any kind of nutritional education happening? Because what's happening is people that are on a fixed income and have limited means are eating less healthy foods, and then obviously the trickle-down effect from that happening affects us all.
Absolutely. So Denise seems enthusiastic about addressing that one.
Because we went, good morning all, Denise Hudson, I'm with New York City. Good morning, Denise Hudson, I'm with New York City Human Resources, Community Affairs for the Borough of the Bronx. We went from employment services to food stamps. Let me just share with you, HRA does indeed have a food stamp and nutritional outreach program, okay? If you'd like to have someone come out to any of the locations in the Borough of the Bronx, Brooklyn, Queens, Staten Island, Manhattan, you could contact Ms. Brenda Williams. Her number is 212-331-4611. And, of course, you always have myself. And, Jeff, you know my number. Thank you.
I just wanted to see you come up front.
I know. You want to see me run. Okay.
Is that it? Fernando.
Okay.
Hi, I was hearing what you were talking about, the Begin program, and something that I didn't hear in there is technology training. Mm-hmm. I'm not sure if HRA does that, but with the amount of technology that the city uses and private businesses use, and from the last census, from the 2000 census, and the talk of this digital divide, yeah, and whether or not African Americans and Latinos have reached that threshold to be on par, which I don't think they have. What technology training are you offering as an agency, and in what fields? Is it hardware, software? Because everything that I've heard so far provides for jobs that are, you know, not going to pay more than the minimum to survive in New York City.
Okay, so let me answer your first part first, or your second part first. Some of the jobs that I spoke about actually are jobs that are above the minimum wage. And so let me drive down that road just a little bit further. We work with a company that's opening a store on Madison Avenue, Midtown, called 4Food. They are paying people $9 an hour and doing their own workforce training, much like the Marriott Hotel did back when welfare to work first started. They are paying $9 an hour not only because we are working with them, but because they're also committed to helping their workforce not only be successful at their jobs, but then helping these people go out and find other jobs in the labor market that are similar to the ones they're offering. And so they've developed relationships with a restaurant called Chipotle, Chopped, and DiAgostino's, where their training might help people become competitive for those jobs at those wages. In addition, we work with a call center, who's one of our subsidized jobs employers, Aegis Communications, on 80 Broad Street. They're paying people $11 an hour. The better part of that story is that if people take the training and they get Medicare Part D, they'll get $14 to $15 an hour if they pass that training and are successful with those jobs. And so the jobs that I'm thinking of, maybe didn't articulate so well, are certainly above minimum wage jobs. But they don't help people earn a living in New York City, and we know that. And so they're above minimum wage, but we know people need to do better. And so to answer your question around technology, our Begin program has a computer lab. They have technology in all of their programs. Matter of fact, around the corner in the Melrose Center, we have 2 computer labs on 2 different floors where people can come in, and while they're learning education around literacy and English language proficiency, they're also engaging on the computers. They're learning on the computers, and they're learning how to handle those computers. So I would say they're probably learning the basic keyboarding, right, the basics of computer. To what you're talking about, are they learning Microsoft Office and Excel programming? Are they taking the next level up and maybe learning certification and A+ certification, LAN/WAN design and things like that? No. Those programs are programs that are beyond HRA's teaching capacity. Those programs are programs that are taught by community-based schools, community colleges, and trade schools. And so what happens if somebody is inclined to take that training, they have to pass an assessment first that they have the aptitude to be successful in those programs. And the schools would offer that. We offer ITA funding to help people make those enrollments into those programs. So we do work with places like Perscola in the Bronx, right, that does training in that way. Their career pathway program, their state-funded program, and they have plenty of relationships with other people who have partnered with them. Strive has partnered with them, right? And so our people walk through all of those doors to get those services. Part of what we do is make available that information to people. And if they decide to enroll in those programs because they're inclined, again, to be successful in those programs, we will make sure that they get ITA vouchers if they're eligible. We'll make sure whatever funding that we have available, people can take advantage of it and go. But I think the part that we can do is that we do have programs that we manage that do have computer labs that work, they're up to date, they do have software on there where people can learn while they use those computers. But I think to the level that you're talking about where people are going to be competitive to get in the labor market, they need to go to somebody who's a professional at teaching people that type of skill set and moreover can make sure that they're connected to the places where you go to get the certification. So beyond just teaching people the aptitudes that they need to learn that information, they have to become certified. So they have to pass those certifications, and some of those certifications for Microsoft Office, 6 of them. Right? You have to pass 3 of them to be considered a professional, right? So some people know that. And if you pass one, a good school will allow you to take that certification test over again, right, and do remedial training and so on. And so our role is not to teach so much as it is to work with the schools with that information to make sure that people get second chances at it and make sure they get remedial courses at it. And to your point, to make sure that there's off-hour training for them on weekends and nights so that they can do it even if they have child care issues.
Okay. My next question is about the WEP program, and you talk about WEP specifically at parks. We have been notified, or at least I have been notified several times, that the JTP program at Parks Department continues to be cut, and our parks continue to get dirtier and dirtier. And we'd like to know how we can try to restore those JTP workers for our parks, because it becomes a quality of life issue. If nobody's maintaining the parks, then people are going to start dumping, and I have that throughout my parks. And I think this is a borough-wide concern.
Yeah. So my colleagues are saying that's a parks issue, but but I could say to our end, to our
Because
end,
it's funny, they say the same thing. It says,
it's
it's the
a
JTP
HRA
issue.
we actually have given subsidized dollars to parks for the JTP program. So we've not only increased our JTPs at HRA, but we've given parks subsidized jobs money from ERA funds to ensure that they have the ability to bring people on payroll and have more JTP workers. So we've done that.
Okay.
And I'm sure that Seth Diamond would be happy to talk to you about what we've done in that way to make sure that the Parks program does have the funding to continue putting people to work. And we do work closely with their commissioner to make sure that we know when their seasons are for hiring. And I know we do a lot of recruitment for parks. We hit all the boroughs. I mean, weekly we talk about if that recruitment number is where it should be to ensure that people are getting into the Parks program. And so I think you're right. It's a very successful program. We do want to make sure that it does what it's supposed to do. And so, I'll talk to Seth Diamond about if there's any cuts. I know that on the Parks Department they have had some cuts in their programs, but HRA has continued to move funding into those programs the best that we can.
And then my last request is to the BP's office with regards to asking for those borough-wide numbers and then giving that to the...
I was just going to say that.
Giving
Thank you.
that to all of us. But also, if we could have your email
Sure.
that way so that if we ever have questions,
Sure.
in addition to
Right.
Denise, because Denise is great. But
You'll give it to him, or should I give it to him now?
If you
So
can
I have business cards. I
if
can
you
tell
can
now.
just say it, we can
Yeah, I can say
write it down.
So my name is Raymond Singleton. Last name is the way to start out my email, Singleton, SINGLETON, first initial R, at hra.nyc.gov.
Okay. Jim Fairbanks?
Good morning. This
Morning.
is not meant to even be an attack on HRA because it doesn't seem we have the political will to want to give money and employment to the those who have the least money amongst us. Councilmember Foster, when she was elected 9 years ago, her first piece of legislation and first press conference at City Hall with the Parks Workers Union was calling for 12 months training programs, not 6, in all of the city agencies, not just parks and transportation at the time. Intensive counseling, child care, allowing students go to school, to college, which they now can, and at the end, job placement training programs. And I guess we can say that we've worked on those issues and haven't been successful, or else we wouldn't hear horrendous stories about being sanctioned for being sick a day or having a child care problem for a day, so you wait again 45 to who knows how many other days. So before you're back on, and I mean, the governor announced a welfare increase of the cash grant, first time since 1981. So I appreciate that you're working on these issues, and HRA is, but it's so disappointing because there just doesn't seem to be the political will to provide money and employment. Black and Hispanic men in our community are just not even in the loop. So, I mean, I appreciate you outlining the program, but I just have to say in a very disappointed way, not against HRA or against you personally, we just don't have the political will to care. I mean, that's just my strong feeling. Thank you.
If I could just comment on that, I would say that within our agency, people do have the will to care, and not as a rebuttal, but I think what we see on our end that's extremely disappointing for us is we think we've put our heart and soul into creating a program that's designed to help people expedite a process that gives them at least a skill that they can be successful at connecting to the labor market. And, all kind of issues come up. And so you can understand if somebody is struggling to cope with family issues or death in the family or things of that nature. I think we all can get that. But when we realize that somebody's walked in and sabotaged the job because they feel as though the job doesn't pay enough, even at $10 an hour, job just doesn't pay enough, or the work environment isn't as professional as it should be, for me, so I'm going to quit this job. Or just people just leave, right, and don't have a good exit plan or a transition plan for leaving that job. And to know the work that goes in on the side of developing relationships with employers and cultivating relationships with training providers, because at the end of the day, nobody's really getting rich training people for jobs in these labor markets. And you all will know from training providers in your neighborhoods that people struggle to make ends meet trying to do these programs. And part of the problem is that people really just don't have a good understanding of the work ethic that it takes to be successful and to be competitive in New York City's labor market. More than that, I think it will behoove us to help people learn how to better cope, right, and perform on the job while managing, 2-year-olds and 3-year-olds or life crises that come up. We haven't done that yet. Right, and that's been talked about, I think, since the beginning of welfare reform and back in the 80s. Governor Dukakis talked about it when he attempted to do a welfare reform program before 1997. And so I think it's more than just the political will, right, to try to help people be successful. I think for black men and Latinos, they got a really hard way to go. But part of that is being persistent, right, and staying in the labor market and not giving up, not hanging out in the neighborhoods instead of tackling the labor market every day. Or, take that minimum wage job. I did, right? And I'm not the example to follow, but I'm sure plenty of people work 2-3 jobs, right, until they can get to that point in time where they got a break. And so I think in some ways we have to encourage people to try harder, right, knowing that it's going to get more difficult and it's not going to get any easier. So on our end, we see what you're talking about. There are some difficulties, but there are challenges that people can work through that would help us too, because more employers would come and say, you know what, because employers want to give people a shot. But when they get that fella that just came home, right, and is a bit abrasive or threatens them because in their evaluation they got a bad mark, right, or they just walked off the job, and this employer needs them because this contractor now is going to take their business and go somewhere else, or that call center downtown can't be competitive for contracts in the labor market. It's less a matter of programs. It is more a matter of business. And does it make good business sense for these employers to put these people on these jobs? Because there are a lot of people now with masters and bachelors taking security jobs, right, and keeping those jobs. And so what you'll see, I think, is the same way that the youth got pushed out when so many people left welfare and took these fast food jobs. You'll see that a lot of these folks who were pushed out of the labor market are taking the jobs that recipients were getting. And so if people don't gain a desire to, figure out how to make it work at low wages, it's going to be very, very difficult, I think, for people to be competitive for these jobs.
Are they hiring at their offices? I just wanted to keep it real about how far we have to go.
Hi, I had a quick question. Thank you for addressing some of the issues that you just brought up, including the work ethics. But sort of as an addition to that question would be, I think some of the most important things when it comes to job placement is the connections. But once you have those connections, you need the follow-up.
Right.
And I'm wondering what HRA is doing in terms of following up on the people they connect to these jobs. Is there retention or satisfaction measures being taken, and
Right.
an assessment of the process itself? Are the constituents happy with the way that HRA is handling their case? And,
Right.
what other types of counseling can they get?
Right. So there's another two-way street, right? So I would say open and honestly up front that we could do a better job at retention, right? Right now, the way it happens, there's so many people that we're putting to work. Last year, we put 75,000 people to work. And it's really hard to keep track of all of those folks. And it's really burdensome for us to call employers and say, hey, is Ray Singleton still at work? Because they've got a payroll of people. They've got to go find Ray Singleton and say, Ray Singleton's still here. Thanks for calling and asking, right? And so what we tried to do is create a process where employers can work in a database. We could send them what we call a hire sheet, and they could just click off, these people are still here, right? For the subsidized jobs program, they send us in a report that says we want to get reimbursed for these wages we paid. So obviously we know those people are still on the job, right? They're submitting, at least we think they are. They're submitting a payroll to us for us to reimburse, all right? The two-way street is that if we make a phone call, we outrage the people. People have to do it back, right? And so again, before people decide that I'm going to leave this job, it would be great if they could work out a transition plan with us and call, right? So part of retention is the fact that people call and check in, just like a staffing company, right? I'm here today, I showed up, work is great. I had this problem, this thing came up, yada, 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 or this is not the job for me, I'd like to quit. Wait, don't walk off the job today. Right? Let us work out a transition plan so we can get a new worker there so this employer can continue to do business. And you can come back to us and we can send you somewhere else. Right? So we haven't arrived at that point yet. People still walk away, right, and then get lost. Right? Now we can't find them. We can send them letters. We can call their cell phones. We cannot get in touch with them. Right? Sometimes. And there are some people who are successful and say, I never need HRA again, and they'll continue to do well. Right? So retention is tricky. I think you need a big workforce, right, if you're going to have an intensive retention program. And then you have to really do a cost analysis. Is that really worth your time and energy to do that? And it doesn't make good business sense to do that. But I think you're right to just comment on what you said. Retention is key. It would be helpful if it was a two-way street and we could interact with people so that we could help them advance on the job with the employer being in the mix. Because the employer would love to say, Ray, here's our performance metrics, right? So from Aegis, I get emails from them that say, for the people you sent me, here's their performance metrics. Some have showed up have missed 30% of their days, right, since they've been coming. Some have made this amount of volume on calls, and they've been successful at 80% of the calls they've made, right? So we are just now getting these performance metrics from employers, and that's great. But we couldn't do that for all of the employers in New York City, right? And I don't know if we want to get in their business to that degree. It's just sort of like we want to take a look at how people are performing, right? And retention really should be that for people who need it, we're there for them. And I think, pretty much that is how our programs run right now, right? So if people don't need us, they go and they keep moving forward. For people who do need us, they can communicate with us the same way that we would try to outreach to them and help them be more successful either at that job or at another job that we could put them into.
All right, thank you. And then I had a quick second question. I just attended a summit on green jobs last week at the Bronx College, and I was wondering what measures HRA is taking, if any, in connecting people in the Bronx to green jobs here and developing that economy, because it is very helpful towards the local community in the Bronx, because I think a study released a couple of weeks ago showed that the Bronx and Brooklyn had the highest unemployment rates out of all New York City.
Right, that's correct. But just to big up the Bronx has actually done a little better. So last year, January, this time they actually had the biggest increase nationwide in terms of jobs, and that wasn't because of the new retail piece. It was actually because of education and social assistance and because of healthcare jobs where people went to work. But to your point, we have certainly done a lot of work in green. Theodore White had attended the same conference that you did, and we stay in touch with people about green jobs. What we've done is we've developed jobs in weatherization, solar energy paneling, maintenance, people using environmentally friendly products so that, what we understand about green is this, right? Most of the work is the same, it's just using different material. Right, so the skill sets are still the same, training people to do weatherization, still having people who have electrical skills, carpentry skills, working in, basic construction or light construction, right? And those jobs are still hard to fill, and they still are hard to fill in the green industry as well. The weatherization programs have not taken off because we don't have people pushing buttons on energy audits. So a lot of the landowners and the property owners are not saying, come do an energy audit so that I can see how much money I will save over time. And we haven't seen a lot of these jobs take off. We are in touch with David Happenstall over at the Association for Energy Affordability. We do work closely with him. Some of our vendors, Seedco and Goodwill, have made headway in the developing jobs in the green industry and training people. We have a number of training programs for solar energy, weatherization programs, again, maintenance. We worked with a company out in Brooklyn, biodiesel fuel that's recycling fuel. So we think we've certainly made our footprint, not to be funny, but we've made our footprint in that way, and we've worked with a few companies that are doing it. And we've started these training programs, but I think like everybody else realized that the energy efficiency sector has not taken off yet to the point where we could just start putting, loads of people into these jobs. We still have to move cautiously. We still have to be responsible about who we're pipelining and putting into training programs so that when they finish, they actually have jobs to come out into, and they're not just sort of sitting around with these new skill sets with nowhere to go. And so we are in that mix. We are working down that road, but we're also being cautious, and we are trying to help the employers take advantage of the wage subsidies that we're offering so they can hire more people.
Thank you. I don't see any other hands up. I want to thank you for a very comprehensive report.
Absolutely.
Thank you.
Thank you.
Our next presenter is on the study on health problems of Hispanics and Latinos living in the U.S. We have a presentation by Jessica Clemente of the Hispanic Community Health Study.
Good morning.
Good morning. How are you?
Good morning, everyone. Thank you for this opportunity to share our research and outreach efforts on the Hispanic Community Health Study. My name is Jessica Clemente. I'm the Outreach and Retention Coordinator for this study. Let me move on to the slideshow. I am with Albert Einstein College of Medicine, like I mentioned, and I'm just going to cover some highlights of the study and go over purposes of the research that we're doing. So this is an overview. Our presentation is certainly wanting to inform community leaders and about the study and benefits of our research, work with community stakeholders on how best to inform the community of our research and to support recruitment efforts, and also establish a network that will provide the venue for us when we are ready to disseminate results when they're available. Why, you may ask, a study in Latinos? Okay, well, over the prior decades, there has been real effort to study health diversity, health disparities in various diverse communities. The Framingham Heart Study was one of the first studies that evaluated health effects in white, non-Hispanic on health conditions, on heart disease, pardon me. Over the 80s and 90s, similar health studies have been increased in African American communities. And now, however, no such research has taken place in Latinos. Hispanics, as you know, have an increased, fastest growing population nationally. Despite this rapid growth, no such research has been conducted. There is limited research and no data on personal lifestyle practices and health conditions of Latinos. Moreover, disproportionate rates of Latinos have fewer economic resources and may be employed in occupations with exposures that could adversely affect health and increase risks of disease. Why here in the Bronx? Primarily because the Bronx has a high population of Latinos. This is, as a result, National Institutes of Health has formally sponsored this research, and it is a multi-site study. We're taking place simultaneously in the Bronx, Chicago, San Diego, and Miami. Primary goals of the study is to study the protective and harmful risk factors of diseases, disorders, and conditions of Latino adults, to determine the role of acculturation and disparities on health and disease. Diseases being studied include heart disease, asthma, hearing loss, stroke, diabetes, dental health, obesity, and high blood pressure. Causative and protective factors include dietary intake, physical activity, stress, occupational exposures, healthcare services, and poverty. The study timeline. We're in our first full cycle of recruitment. The first participant was enrolled in 2008, and we're at our first stage of annual follow-up. What does this entail? In your packets, I have a brochure that will describe exactly what their participation is as far as coming to our One Fordham Center research clinic. Not a research clinic, it's an exam center, pardon me, where we do a comprehensive workup on various exams, EKG, dental, sleep analysis, nutritional intake. We provide these results to the participant and we encourage them to share it with their primary care physicians if they have one. If they don't have one, we have a medical referral service that's networked with Montefiore and the other hospitals associated with Albert Einstein to provide them with that type of primary care physician support or special referral service. Outcomes and ascertainment is going to run through 2013. It's a long-term study. It's an observational study, which means we're not intervening in how the participants live their lives, but we're just observing how their exposures may affect them. This is a completely randomized study. This is solely being conducted in the Bronx. What you see here is census tracts that have been selected for our research. Participants in these areas have been targeted for high and low socioeconomic status, education levels, and proximity to the exam center. This is a caption of our recruiters, and I put this for a few reasons, right? Our recruitment effort is to recruit 4,000 participants. Study criteria is Bronx-only residents. They have to identify themselves as Hispanic, Latino, and be between the ages of 18 to 74. The recruitment cycle is through the end of next summer. I say this all to say two reasons why we're here, not just to talk about the study, but the support that we need from our community leaders. With regards to safety, primarily in the field, with the recruitment effort. Want to know and be able to establish that rapport with police precincts and community affairs officers to know what we're doing in the community so that in the event we are there and something may or may not happen, we have that built-in communications. Additionally, we want also to build the momentum about the research and how it could affect the long-term health policies and decision-making as we move forward. Okay, so our advisory board consists of many members that you may know already through various work in the field, in the community. I put this slide up specifically so that we can open the floor for any of those who are interested in becoming an advisory board member for SOL. Advisory board members primarily contribute with outreach and retention strategies and implementation. Additionally, we look at medical referral development, building that network referral base so that we could provide social service resources to our participants. Additionally, we are looking at how we will discuss the dissemination of results, establishing a venue so that when the preliminary results are available, we have that established. These are promotional materials also found in your packet. This is us at Fordham Plaza. We set up a table there every summer to try to hand out information. As I mentioned, and I don't know if I mentioned it, but it's completely voluntary to be a part of the study. It is selected at random. So letters are sent to households that are selected, okay? That sample of the letter is in your packet. So not anyone could participate in the study, unfortunately. This is our website. I'm going kind of fast because I don't know how much time I have, so pardon if I skip anything. All right, so this is our website. It's saludsol.net. This is also found in your packet. And so let's get down to the primary reason why I'm here, right? Things you can do to help ensure the success of SOL. Localized public service announcement, coordinating with local media broadcasting schedule. So SOL has a kind of cookie cutter public service announcement that all sites share. Observations and feedback received was that if we had a localized or local person who could add a personal touch to this message would help increase and outreach for the study. Press release on the study and the importance of supporting health research. As you know, in a lot of our communities, a number of studies have taken place and in some respects may be overburdening our communities. But the fact is, health research is certainly important in how we move forward with our health policy decisions and really trying to share this with the local community and impress upon them the importance of supporting research like this. Thirdly, we want to build this community network with local businesses and faith-based organizations so that we could establish a rapport with them and so that we could provide community education workshops. We certainly want to offer this as a benefit to the community. We are with Albert Einstein College of Medicine, and there are a number of really good, prominent researchers and a lot of work that's taking place that we want to build and share with the community to bring them up to where we are with our research. And then our website, naturally, we could post, or you could post you could post our link to your website and our recruitment video. That would be a big support. and participating in our upcoming community event. SOL is a long-term study. However, it will conclude in 5 years for our site. However, the events that we are putting together are in recognition of the study, but also in retention because it is a long-term study. So what we're doing to retain the participants that we have. And one such event is called Soul Family Day, which we put together last year, and Cedric was a big help for us because we had it at St. Mary's Park, and this year we're trying to do it at Roberto Clemente. And so I want to reach out to the respective community district managers, and really kind of build in this network. We're really trying hard to offer this as a resource, offer our services as a resource above and beyond this research to the community. All right, and finally, becoming a CAB member. I know Melissa Cebollero is a CAB member of ours as of late, and her contributions have been a major help, and which actually allowed me an opportunity to present here today. So that concludes my presentation. Sorry, I speeded right through it, but I do want to offer myself to questions, and I think that would be more of a benefit to everyone if I just open the floor to that. Yes,
Kenneth.
Hi.
Hi.
My name's Kenneth Kearns. I'm district manager for Bronx Community Board 10, and we're in Einstein's immediate catchment area along with Weiler. We did have a presentation at our Health and Human Services Committee from your organization. So I was just wondering how we could help you, because what we have is a growing Latino population, and while they may be covered because they're middle to upper middle class, they may be covered by third-party healthcare providers themselves through their employment plans. We have a lot of them work for the government. What can we do to help you make more of an indentation in our board service area?
Thank you for that question. First and foremost, whether participants who are selected have medical health insurance is not a limitation in their participation in this research. You don't have to have medical insurance. This is not a medical insurance type of system. This is just an evaluation of health effects on selected Latino groups. We have a high catchment area in the Co-op City location, in which we're having some challenges with as far as recruitment. So perhaps co-sponsoring some health workshops or outreach tabling and things of that nature.
The way Co-op City works is everything is done through River Bay Corporation.
Yeah.
And nothing happens without River Bay Corporation.
Okay.
So have you reached out to them?
Yeah, early on. Okay, so what happens with our recruitment effort? It's in cycles. So we go through the various zip codes in one cycle and then return to those zip codes.
Yeah, we can have an offline conversation because I don't want to take up people's time.
No problem.
And I can give you contacts if you're having difficulties in Co-op City. But we also have Throgs Neck houses.
Yes.
And we also have Randall Balcom houses. And there's a sizable, particularly older group of people living in Randall Balcom and Throgs Neck that are, really could use your services because I think that they're medically underserved from what we can tell. And it would be beneficial. So we'll have the offline discussion.
Absolutely. Thank you for your support.
Cleveland.
Oh, sorry. Cleveland back at Councilman Seabrook's office.
Good morning.
Good morning. I was perusing your packet, and I see that there are 4,000 targeted participants per catchment area.
Yes.
Question number one is, upon the conclusion of the study, are there currently plans to interface with some of the national policy organizations, like the NAACP, like the National Council of La Raza, to come up with a formal action plan to put some budgetary figures to these needs? That's my question, because I think, I applaud the study, but I think hopefully that there's some thought given to what comes thereafter. And I, like Mr. Kearns, am definitely interested in seeing kind of what type of headway you can make up in that Co-op City area.
Absolutely. Right. So this is a national study with regard to the fact that we're holding the same study simultaneously in 4 cities. We have been working with the Council of La Raza and other national entities because this is sponsored by the National Institutes of Health, this research project. And so we are looking at how we could take this to the next level. Absolutely. I think that's the way we're going to be able to move forward and make that impact needed in health policy with regard to Latino health.
And As a follow-up, there are various colleges and universities with graduate programs, in particularly here in New York City, like Columbia, like New York University, that have nationwide import when it comes to health policy and administration. Has this project thought about interfacing with one of those respective entities?
If I'm not mistaken, those entities were in competition for this grant, and we were awarded the funding for this study. Does that mean that we're not collaborating with them? No, absolutely not. That would be taking part on the behalf of my principal investigators and looking at what other research can be taken as far as ancillary studies. So this would be considered like a mother research. This is the foundation of a lot of what we're collecting, so that other up-and-coming principal investigators of other institutions are welcome to use this later and request this data to launch their own ancillary studies, their own separate studies. So that's in the way that we work with other institutions and collaborating in that respect.
I would be interested in that further.
Absolutely. If you visit our website, you could see some of the ancillary studies that are currently taking place and what institutions are being are coordinating that effort.
Okay, thank you.
So just to give you a little highlight where we are currently, in our Bronx Field Center, we are responsible for recruiting 4,000 participants. We're at just a little bit over 2,000 participants, and our recruitment cycle is ending next summer. So with that said, we have a long way to go, and so our outreach effort is something that I have to amp up. I am responsible for retention, which is the annual follow-up, and not only the front end of the study, but also the mid part of the study, which consumes a lot of my focus, because this is the first time this study is taking place. And so we're really trying hard to get the word out there. And your support and your attention, I want to thank you in advance for this opportunity. I welcome all the feedback and any questions with regard to the study. I'll be more than happy to stay after and discuss. My business card is in the packet. Okay, so my contact information is there. I'm sure I'll be reaching out to each of you individually anyway, but I certainly appreciate this time, and I'm sorry if I went too fast. I know there are a lot of people on the agenda, and I wanted to respect that.
Thank you so much, but Kenneth Currents has one more question.
Absolutely, please.
I think you said, if I heard correctly, that you were doing the study, but you weren't trying to do any interventions. How come?
It's an observational study. So we're not telling them how to change their eating habits or how to make any changes. However, the fact that we go over what they eat, the fact that we go over and evaluate what their intake is, I think opens their minds in how they can make the change on their own. So we don't directly tell them this is how you should live, right? But the fact that we're having that dialogue with them, the fact that we're evaluating those various aspects of this of health is opening their eyes to how they could change their own lives. And actually, we've gotten that feedback from participants is one of the take-homes, because it is a voluntary study. We do compensate them for their time and effort, although the amount is very nominal. So you want to try to give and provide more. And so I think that kind of awareness is one of those areas in which we provide that support. Additionally, the medical referral, I think it's another key component that I haven't really went over as much. But for those who are in our study, which is Blind to Legal Citizenship, is one that, so I lost my train of thought. All right. So we're blind to legal citizenship. So those who are immigrants to our country who are not documented can participate in our study. And actually, we encourage that group because this is the group that we're of most concern for. They're the ones who have limited health care access. They're the ones who are not going and really being documented on what their current health conditions are and how their acculturation into our community is being captured. So this medical referral service offers them that opportunity to be referred to a primary care physician from any one of our community advisory board members or from the institutes within Montefiore Medical Center. So what do? We provide their primary care physician either at no cost or on a sliding scale, depending on whether they already have insurance and it's limited and so on. So we're really trying to provide more of a give back to these participants who are in our study.
I want to thank you for your presentation this morning. It was very, very informative.
Thank you. I appreciate the time.
Okay. We're next going to car sharing text amendment. It's a presentation by Ryan Singer, the Deputy Director of the Bronx Office of City Planning, New York City Department of City Planning.
Okay. Good morning.
Good morning.
It's still morning. I am actually just here to introduce Stephen Johnson from our Transportation Division and Howard Slatkin, who's our Deputy Director of Policy and Strategic Planning. And they're going to talk about a car share text amendment, which will be referred out this month, a little later. So we'll be coming to the community boards to present that to you guys. And I hope if you have any questions, please ask them here now, and we can always get back to you, in an ongoing basis.
Thanks, Ryan. I'm just going to give a brief introduction. I'm Howard Slatkin. Just want to give a brief introduction, and then Stephen Johnson, who's our project manager for this project, is going to run through a presentation that will explain a bit about what car sharing is, why we think that there are zoning changes that make sense involving car sharing, and what the benefits of those changes would be. But this is, as Ryan mentioned, this is a proposal that we're taking to you today as a kind of a preview. It will be referred out. We expect this would be referred out later this month for the formal public review process, so it will come back to the Borough Board for a formal review and vote later on. But we wanted to take this to you today to give you some information and get any initial questions that you have so that we can better be able to answer those questions as we get into the public review process. So car sharing is a service that we think can provide New Yorkers with a wider range of economical transportation choices, convenience, mobility, and wider range of opportunities. But it also has broader benefits for people who don't use the service, for the broader community and for the environment. This proposal, we think, is an item that has probably the greatest significance in Manhattan and other more central parts of the city, but we do think there is significance and potential for this within the Bronx and the other boroughs as well. We believe, though, that what we need to do is have a zoning text amendment that takes this new phenomenon of car sharing, provides for it clearly in the regulations so that we know exactly where these vehicles can be parked in off-street parking spaces and where they can't be parked. So without further ado, I'm going to turn it over to Steve Johnson, who has our presentation.
Thank you, and thanks for this opportunity for presenting our project. I'm going to go through the benefits of car sharing, what car sharing is, how it works, and our proposal. So the concept of car sharing is fairly straightforward. An individual gets the benefits of car ownership without the costs and responsibilities of owning a vehicle. These are some of the characteristics of car sharing. It's a system with a fleet of cars available to the members. It's open to the general public. Anybody can join a car sharing organization. The cars are available 24 hours a day. They're at unstaffed locations, and the car share organization provides all maintenance of the vehicle, fuel for the vehicle, insurance for the vehicle. So this is a graphic of how car sharing works. You become a member, you join. In New York City, it's currently about $40 or $50 to join a car share organization. They give you a key card that gives you access to a car at a location. You use your phone or your computer to reserve a vehicle at wherever the cars are located, close to the membership. And then you reserve it, and then you go to your car at a group parking facility, and you get in and you leave. And then it's up to you how long you want to reserve the vehicle. It's more cost effective for shorter periods of time. So 2 hours to 8 hours is usually the range of reservation. And then you go straight back at the end of your reservation to the same parking spot where the car share company pays for the parking. Now, car sharing is not something that's unique to New York City. It's across the United States. It's in Europe. It started in Portland in the United States. And there's a bunch of different models. There's for-profit companies, non-for-profits, and different sizes. There's small with just a few cars and larger ones with over 1,000 cars. In New York City, there's currently 3 car share companies: Hertz, Connect by Hertz, Zipcar, and Mint. Mint is a small New York City only company, and Zipcar is the largest in the New York City area. Now, car sharing still represents a niche market in the United States, but as you can see from this graph, it's growing rapidly. New York City accounts for over a third of nationwide membership in car sharing. So the New York City market is a very successful market for car sharing. Now, the benefits for car sharing, there's a variety of benefits for the individual and broader community and environmental benefits. It's affordable. If you drive infrequently, less than around 70,000 miles annually, it's affordable to use car sharing. It's less expensive than owning a vehicle and all the costs associated with it. It increases your mobility. If you want to go to New Jersey that may not have subway access, or the bus service stops at a certain time, if you want to go somewhere in Long Island or up to Connecticut, you just reserve it for a few hours or do some local link trips. Also, a key point that we're trying to make with our presentation is that it replaces a number of vehicles on the roadway. So studies have shown that between 6 and 32% of users who join a car share membership give up a vehicle. They either get rid of their second vehicle, they postpone buying a vehicle, or they get rid of their primary vehicle. And that's significant. It's called car shedding, and people get rid of their vehicles. And of course, when that happens, then you have a reduced demand for parking, eases some of the parking crunch, and it helps reduce congestion in the number of vehicles on the roadway. So this is a graphic that shows how a car share vehicle works versus a private automobile. So you have a car right in the center there, and you have one or two people who share that car or who own the car, and they take their vehicle and they park it in a parking facility. Now with car sharing, you have approximately 40 members who share one vehicle. So you take that one car and you park it in the same parking facility. But as studies have shown that a number of people who join car share organizations give up a vehicle. And when you do that, it has potential to ease the parking demand and ease congestion because you're reducing the number of vehicles. So studies have also shown that car sharing is an efficient model for driving. And it's an effective way of reducing the number of miles you drive. So with car ownership, you have upfront fixed costs that are quite substantial. You have to buy the car or lease it. You have to pay for insurance and maintenance. But then costs per trip are relatively low because you have those upfront fixed costs. Now with car sharing, it's reversed. You have the upfront fixed cost is a $50 membership fee, which is pretty low, but that's your fixed cost for joining. But then your cost per trip is how you get charged to reserve the vehicle. So I think in New York City, it depends on the vehicle you reserve, but it's $10 to $16 per hour. So what happens is people end up reserving the vehicles, and they link their trips together. So they say, I want to go to the grocery store, I want to go to the gardening center, and I have to go to the post office. And they think, well, I'll make 2 of those trips, and then I'll take the subway instead to go to the post office. So what happens is people, once they join, they drive less frequently because they see the costs associated with cost per trip. And the studies have shown that people drive less frequently once they become a member. So where is it located in New York City? The bulk of car share membership is in the high density and medium density areas of the city, and based mainly in Manhattan. Hertz Connect locations are almost exclusively in Manhattan at the moment. Zipcar is more equally spread around the city, but there are majority in Manhattan. But they're in downtown Brooklyn. I think the Bronx, we just checked this morning, the Bronx Zipcar has 11 cars at 7 different locations in the Bronx. And the point is that they're expanding. These car share companies want to expand into medium and higher density areas in the rest of the boroughs too. And the car share locations where the vehicles are in proximity to their membership. So the memberships are all in the higher density areas, so that's where they locate their vehicles. So the issues with the current zoning, the purpose of our resolution, as Howard mentioned earlier, is that our zoning regulations for off-street parking were written back in 1961, when this Lincoln Continental was roaming the streets. Now, car sharing is something that's happened over the last 10 years, and the zoning resolution didn't anticipate car sharing. So what we're going to do is try to write clear guidelines on where these car share vehicles can park, and get all the city agencies on board with it, and have an established benchmark for where they can park. So the first step in doing that is defining what car sharing is. And part of this is defining it versus car rental, because they're different. They have different benefits. Car sharing has a whole slew of benefits that are not necessarily associated with car rentals. And I've already outlined a few of those with the car shedding, the less miles traveled once you become a member. So what we've done is we've said car sharing has to have these attributes in our proposed zoning text. It has to be open to the general public. Anybody can open. Cars have to be available 24 hours a day. Car share organization has to pay for the vehicle, the maintenance, and the fuel. And the vehicles are at unstaffed locations throughout the city. So a car share company cannot set up a shop in a garage and have somebody hand you keys for it. They're unstaffed. It's like a regular private vehicle that's located in a garage. That's the purpose of the key card and the reservation by phone. So where would our proposal, where would it apply in the city? As I mentioned earlier, it's really been successful in medium and high density areas of the city. So we have the most flexibility in our proposed regulations for our proposed text amendment for medium and high density residential districts and in public parking facilities. In lower density residential, community facility, manufacturing, and commercial, we are saying it's limited to larger parking facilities, which would mean 20 or more parking spaces. And then in 1- and 2-family residential spaces, it's not generally allowed because we don't want people renting out their driveways. And another point I wanted to make is that it's up to the individual garages and lots whether or not to allow car sharing in their garage or lot. This is not a requirement. It's just allowing it. It's up to the whoever's running the facility whether they want to have that car share vehicle parked in the facility. So now I just have a couple more slides showing the proposal of what we're proposing for this text amendment. So in accessory residential garages and lots, car share vehicles would be allowed to park in 20% of the total spaces or 5 spaces, whichever is more. Our example for the medium and high density residential is this 30-space garage. So up to 6 car share vehicles would be allowed to park there. Not required, they'd be allowed. And if those car share vehicles were in that garage, then we anticipate that between 14 and 77 cars in the general area would be eliminated. And that would, again, ease parking demand in the general area. Because as the studies have shown, as I mentioned earlier, that once the car share vehicles are in place, people give up their vehicles and there are fewer cars. Public parking garages and lots. Our proposal is for 40% of the total spaces. Could be for car share vehicles. Currently, their car share vehicles, the majority are in, they're called pods. They're located in, they call them pods where the number of vehicles are. And it's the majority is 1 to 5 vehicles. Currently in Manhattan, there's one location where there's 20 vehicles, and that's in the highest density area. So these vehicles are generally located in small numbers because they want to disperse them throughout the membership and throughout the city so people have more access to them. So for public parking garages and lots, our example is this 30-space facility, and up to 12 cars could be used, would be allowed to be car share vehicles. And we estimate that could potentially eliminate 28 to 144 vehicles in the area. It's a wide range, but the studies have shown that it depends on the area and the market and the region as to how many vehicles are eliminated. But I wanted to point out that the number of vehicles eliminated is always more than the number of car share vehicles in a parking facility. So if you have 12 vehicles, car share vehicles, you're eliminating between 28 and 144 vehicles in the area. So for the lower density multifamily residential, up to 10% of the total spaces can be for car share parking, and that's if the parking facility has 20 or more spaces. Our example shows a 20-space parking facility where 2 car share spaces would be allowed to park, and that has the potential to eliminate between 5 and 26 vehicles. Commercial community facility and manufacturing, it's the same. 20 spaces or more, then you can put in up to 10% of car share vehicles, and it's the same example of 2 spaces in the 20-space facility. The lower density 1 and 2 family residential, we're not allowing it in these districts because, again, these are small, low density, fewer number of people in the area, and we don't want people charging for the driveway space. Except we have allowed for the provision of parking in colleges and universities. One market that's been very successful for car sharing is at colleges and universities. And I think nationwide there's been over 150 colleges that have signed up for car sharing that have them on campus. And I know New York City, the schools here, I think Columbia, I can't remember if it's Columbia or NYU, but they have 1 or 2 vehicles at a medical facility. They haven't expanded it yet, and I think LaGuardia might have 1 in a parking garage in Queens. But it's been a successful market for car sharing. So we wanted to allow that to happen for colleges and universities. But again, it's not allowed in R1s, R2, R3A, all along the bottom there. This is just a chart that shows the numbers in a different format by zoning districts and the percentages allowed. You know, I can get anybody here information. I can send this chart. I have a handout that has my number on it and some of the details also. And that wraps up our presentation. And if you have any questions for us, we'd be happy to answer them.
Yes, I'd like to know, what is the annual cost for participating in this program as a driver?
Whatever the annual membership is, plus however often you use the vehicle. So if your membership is $50 annually, and then if you reserve a car that's $10 an hour, it's up to you how often you want to use the vehicle.
You have various size cars and vans.
Yeah,
are
that's
vans
correct.
included in this?
Yes, vans are included. So what happens if you need to go to IKEA or Home Depot or somewhere where you have to haul some stuff, you can rent a SUV or a larger vehicle.
And you can you rent it as needed, as you do a rental car?
Absolutely. It's you make the reservation for every time you need it.
These are what we're describing the way the various companies that operate in the city work, and actually we can offer an anecdote to support that question of what kind of vehicles are available. Mm-hmm. A colleague of ours who has a son who plays hockey, he sometimes has games that are outside of the city. And several, she has to take him and several of his teammates to the games, but 4 kids and 4 hockey bags don't fit in an ordinary car, so she rents a minivan for the evenings where those games occur, and then is able to just, rent the car for just the hours that she needs it, and then return it to that spot. So.
Cleveland?
Thank you, Madam Deputy. You actually asked my first question, which was all different types of vehicles available. First, a concern. Unless you really can give us a clear depiction about the ratings in terms of the costs, I would be a little concerned about the hours, someone being assessed a particular rate by hourly as opposed to miles driven. That's number one. And then secondly, while I applaud the ingenuity of this proposal, part of my concern would be, number one, if a mixed-use developer, let's say someone's trying to do some mixed-use development, and they want to incorporate this aspect as a part of that plan, are they going to be, would that mixed-use developer have access to tax abatements in connection with this program?
There's nothing as part of this program that we're offering that involves tax abatements. for that. The only thing that we're proposing as part of this text amendment is to modify the rules that tell you how you're allowed to use parking spaces, off-street parking spaces, and so we would allow that.
I understand your proposal, but the reason why I asked the question is once an amendment is made in regards to zoning, my question is down the road in a non-dense area, could a developer seeking to gain the tax abatement privileges, secondly, this proposal admittedly would help with the 2030 plan, is that a possibility that a developer would have accessibility to tax abatements in connection with this program?
I think the short answer is no, because the parking and tax abatements and those types of things are generally just linked to the housing units and those things. This is just a parking change. Actually, this doesn't change the required parking.
Okay.
So if they get the tax abatement for the housing, whatever their parking requirement is,
it still stays.
They have to get that. Okay. They can then, use this, provide, car share spaces. That would be a separate thing. So it's not linked to the tax abatements. This is just a parking change.
And then my last question is in regards to the proposed vendors. You mentioned Zipcar, which I actually have seen around the Bronx. Is that going to be done via RFP, or depending upon which of those associated vendors will make the necessary commitment to have these centers placed?
This is not a subject for RFP because it doesn't involve parking spaces that we own or control. It's merely allowing the companies that exist to work.
Okay.
Fernando?
Hi. With regards to the municipal parking facilities, does this include existing municipal facilities?
Yes.
Okay. And the reason why, because then it does include public spaces or spaces that are city-owned facilities, and will there be an RFP for those?
Right. That is a separate question because the city retains control over how it chooses to use those municipal parking spaces. Right. There's an operator agreement for each municipal parking facility, generally between DOT and an operator, and the terms of those are going to can be determined. This would not require anyone to put any vehicles anywhere. This would just merely make it lawful under zoning to do that.
Okay. Because in my district, I have two municipal parking garages, and they currently are operating at 125% capacity. So where are we then going to find the space for this program to fit in?
Well, I can't offer you any answers for a particular parking facility because obviously the city DOT sets its policies about how to operate those parking facilities, and nothing in here would change anything about the way those facilities are operating today. The one thing that I would point out, though, is that we do have these data and studies that show that when a car-sharing vehicle exists in an area and there's sufficient membership to support it, which is the only way that a car-sharing company is going to pay the money to continue to put that vehicle there. When that vehicle is available, it does reduce the number of automobiles that are owned in the surrounding area. Between 6 and 32% of members give up a vehicle, and what that means is that overall, not necessarily for that particular spot, but overall what it does is it reduces the competition for parking spaces. So it has an overall beneficial effect.
See, but in those municipal parking garages in my area, these are all commuters from outside of the district. So
right.
I don't see how then those individuals will benefit from Zipcar unless they have a Zipcar program in Westchester or in Yonkers or someplace else. I also just want to ask about, I know this is all off-street parking, but is there a plan or is there a thought about doing on-street parking in areas that are where no parking currently exists or no parking signs exist, like on overpasses, so that you don't have people who are illegally parked there, but you have this service that can be provided that is readily available on street?
Well, on-street parking is, first of all, I can't answer the question definitively because DOT is the agency responsible for on-street parking, but it's my understanding that the car-sharing companies don't aren't interested in putting their vehicles on street because primarily of street cleaning regulations and alternate side snow removal and those issues, because there isn't someone around to move the cars when they need to be moved. So it doesn't work the same way as off street.
Okay. John Robert.
Okay. I'll get up. No, okay. I just want to go over some of the mechanics of it. The anecdote you gave about your friend calling for the reservation. Now, what happens if they call and there is no car available? Is there a central? Will it be referred to another, or could it be computerized centrally and say call this place? How would that work?
Well, the way the operators work it today, and I do belong to a car sharing service, so I have had some firsthand experience with it. The way it works is that the reservation system is all computerized, and your vehicle has to be, the person who rented it before you has to return it to that spot. Otherwise, they have some fines. If you return it late, or if you return it full of mud and dirt, they can fine the member for not returning the car on time and in good condition. So the cars are very reliably in place. They're also responsible for refueling the car, making sure it has at least a quarter tank of fuel, although the fuel is paid for with a card that the company pays for. So the cars are there because of the computerized reservation system.
Okay, and just one last thing. In terms of penalties, if you use one of these cars and you get a parking ticket, and you do that all the time, I imagine your membership is shut off, or you just pay and continue?
I think they make you pay the parking ticket, but other than that, as long as you pay your parking tickets,
okay,
you can continue your membership.
All right, thank you.
Pass it to John.
Oh. Good luck.
Yeah, good morning. I had a question in respect to the actual zoning text amendment. So it says it would define car sharing in the zoning resolution, allow car sharing vehicles to park in public and accessory parking facilities. Under the existing resolution, or let me ask you this, would this expand the number of cars that would be permitted to park in those respective facilities under the existing resolution? Would it expand the number of vehicles ordinarily permitted under the zoning resolution?
Well, in terms of the number of vehicles, the number of spaces that are permitted,
right,
that is unchanged. It's the exact same number that are required today, the exact same number that are permitted today. That wouldn't change.
That wouldn't change.
It's just a matter of whether one of these types of vehicles can have a home
could
in one of these
essentially
garages.
have a hold on one of those spaces.
That's right.
Okay. And just one other question is that the owners of the vehicles in question are either Hertz or Zipcar at this point?
Right, or Mint. Mint is a New York City only company. It's a small company. There's only 3 in the city.
All right. So, okay. So these are the companies in question. So essentially what this is also doing is it's opening up the possibilities for these companies to cite potential vehicles that could be leased at locations above and beyond where these vehicles would currently be situated now for lease purposes?
In a sense, yes, although a major aspect of this is that the zoning today, with our slide that showed the 1961 Lincoln Continental, the zoning today doesn't really say specifically where these vehicles can or can't go. The zoning talks about private automobiles and it talks about rental cars, and we think this is something that's different from both of those categories. And so what we're doing as part of this is trying to clarify that, say what this new creature is, right? And then say that there are certain locations where they are allowed to park and then certain locations where they wouldn't be.
All right, thank you.
Hi, Kenneth Kearns, District Manager, Community Board 10. We have a rather large parking lot in our board service area at Orchard Beach, and it's really not utilized most of the year. Its primary use is during the summer months. And you know, I'm wondering, would that be a viable location for an operator to place cars? Because we do have a need for that in our board service area. We have a high commuter traffic situation where they take up spaces. And you
know, I'll try and answer this question, but Ryan can maybe can add to what I say. It may make sense, and I think the only way to answer that question is really to ask the operators, because the operators are the ones who.
That would be the parks department of the city.
Oh, I'm sorry. I don't mean. My mistake. I mean the operators of the car share companies. In terms of whether they see the potential for, sometimes they do go to communities and they sort of hold events and sort of try to solicit membership to see whether there's sufficient interest in the space. One of the things that can be tricky, and I think the Orchard Beach location might be one of these things, is that they like to locate the cars within walking distance of people's homes wherever possible, and that makes them convenient and accessible, and I think that might be a challenge at that particular location.
Yeah, I think Howard answered that question in terms of Orchard Beach, although one of the things is we do think that this actually in Pelham Bay and on Co-op City could be something that they would look into. There's parking problems definitely in these neighborhoods, and the benefits of these programs could, help eliminate some of those cars. If you have the family that has two cars, they use one every day, the other one kind of sits for the week till the weekend. They may choose to then get rid of their second car if they have this car share opportunity.
How would one go about this? Would we work through your office?
And if you are interested in having the car share people come and talk to you guys, we could,
help put you in touch with
we can help you. Yeah.
Wenzel?
I'm a little slow. I'm not really sure the difference between rent a car and rent a car.
Right. So the biggest difference that we've found in looking at this, and there have been some transportation studies in different parts of the country, is the availability of the car by the hour, and the fact that you can just reserve it, walk to it, and get the car. This is what helps it serve more like a substitute for having a car yourself. With a rental car, you have to reserve it in advance. The price isn't always the same when you want to get it. I'm not knocking rental cars. Rental cars have a role too. It's just they serve a different purpose.
I understand the purpose might be different,
Right.
but it's still renting a car.
You are renting a car, but it behaves differently in part because you don't go to a desk. There's not a business operating there, right? It just acts more like a car. So we don't think it's a concern like having a rental car desk in a residential neighborhood wouldn't necessarily be appropriate.
It's technology.
Technology is a big part of it.
You're renting on the internet or on a phone call versus renting from a person standing behind a desk. I mean, and I respect that.
Sure.
I mean, in the community where I live, there's a lot of hotels that rent by the hour or rent overnight. It's still a motel.
It's a very different kind of business, yes.
And asking these questions because I know since he is the chair of transportation committee, he has his own points of view on this. But one of my questions would be, in terms of proposing these zoning changes, what kind of incentives are you going to provide to the owners of the parking areas to actually provide these spaces? Because once you allow it, it's fine. But what makes them want to allow it? Because for us, it's a great thing to have greater parking spaces. But for them, they're running a business. And they don't necessarily want to give the spaces out to cars that take away business from them because they're getting less cars.
And that's an excellent point. But we think that the way that this works and the way that we've seen it work where they have placed cars today is that the market tends to address that issue, because if that space is going to take away spaces that are required, that are necessary for the functioning of a business, for example, then they shouldn't rent that space out, and then they won't. But if that space if maybe the parking garage isn't fully utilized, or if there's substantial demand from people in the neighborhood who really need to have a place to put this car sharing vehicle because the company can actually make sufficient money off of operating that car sharing vehicle, then they're going to try and find a space for it. And they're going to look around for the parking facility that makes the most sense for them to put that vehicle. And we don't claim to know what facilities these vehicles are going to make the most sense in, but we want to have rules that allow them to be located where they are going to make the most sense.
Thank you.
Pass the mic down to Jeff for me, please.
Thank you. I have a specific question about the about the text amendment. Would this amendment allow mechanical-owned garages in terms of like businesses that operate as mechanics and auto repairs? Because I know in our district, there's a handful that have huge lots that do that sort of stuff, but there are not as many commercial garages. So would they be allowed to apply to become a car sharing facility?
Okay, so where the zoning does allow, this is like an auto repair facility you're talking about?
Right.
So if the zoning allows that auto repair facility, the zoning will also allow, today already does allow car rental, and they would also be allowed to put car sharing in. That would be allowed.
So is there going to be, I guess, is city planning prepared to do some outreach to so that way in the areas not only downtown Manhattan, but in areas of the Bronx that don't necessarily have these large commercial garage facilities, is city planning prepared to do any outreach to these auto repair places and saying, hey, you have the lot space that would allow 3 or 4 cars to be in the car share program?
You know, that's an interesting question about outreach. We have been anticipating that it's going to be the companies that operate, the car sharing companies that are going to be looking to locate these cars. But we definitely have heard a couple of questions tonight. I don't know. I must have underslept or something. This morning, we've definitely heard some questions and heard some questions from other parts of the city too about bringing the operators out there to look at the opportunities. And I think what we can do is we're still in the preliminary stages here, but we can look for ways to bring the car sharing companies to the table to hear the questions from communities, from elected officials, to try and make sure that they go out and look at all the opportunities.
Something just came to mind. Who's going to be responsible for the maintenance and repair of these vehicles? And what if a vehicle breaks down while I have it at the supermarket?
That the responsibility for all the maintenance goes to the company that operates that vehicle. So it's the car, Zipcar, Hertz, or Mint. If the car breaks down, they have to come and these are all the policies that they lay out in their rental agreements. But it's just like if you have a rental car and it breaks down, they have to come and get you and rescue you, and they take the car and go fix it. But you shouldn't be responsible for the cost of repairing that car.
Okay. I want to thank you for your presentation today. It has truly been informative. Okay, thank you. And now for our food summit. We've been joined by Melissa Cebollero, the Director of Health for the Borough President's Office. Good morning, Melissa.
Good morning, everyone. Thank you for having me again. So I just wanted to give you guys a quick update on the Food Summit. We announced it at your last Borough Services Cabinet, so we hope that you each had time to go onto the website and take a look at what we're thinking about doing. At this point, our RSVP pre-online registration is hovering at a little over 400 people. So we're planning for 5, and we wanted to close online registration and allow for on-site registration should someone walk by and choose to come in. So we may have to increase capacity. I think Ostos has given us an 800-person capacity. So we're hoping to attract that many people. Other updates, Majora Carter is our keynote. We've got a celebrity plenary that will close the event. We've got Melly Mel confirmed. We've got Curtis Blow confirmed. I just got an email right now that Africa Bambaataa reached out to us and wants to be part of this. So the idea for the closing, we're opening with Majora, and we're opening with, big ideas, big policy, and sort of giving everyone the direction of where we should be going. But we're closing with real life. We're closing with Bronxites who grew up here, who went to their bodega down the street, who raised their families here, and who are going to give their testimonial to what their experiences were and how we should be moving forward. So this is really for everyone. We're not excluding any sector of the population. As I mentioned when I spoke with you guys the last time, what I was really hoping to encourage community board membership to do was to identify healthy or identify popular restaurants within your community board districts that really, really feed your residents and challenge them to participate in our healthy restaurant contest. We haven't gotten too much of a response with that. So I'm hoping that the next 3 weeks we'll still have an opportunity to get some of the restaurants in. But the concept is really for the restaurant. What if they've got a healthy, I'm sure they have some healthy menu options, that they highlight those, that they celebrate them, and that they participate in the food summit and market themselves. And if they don't, that they challenge themselves to try to convert their most popular dish into a slightly more healthy version. So I'm really hopeful that you guys can do that for us in the next couple weeks and encourage your most popular restaurants to participate. And then, long term, as I mentioned the first time that we spoke, I hope that food policy and the food agenda rises to the level of something that each community board will tackle as a major agenda item moving forward, however each board sees fit. But that's really something that each of you have to decide. We're moving forward with that as an agenda item. BronxFood.org will stay up and running. It will continue to operate. Any leftover funding from the summit will stay in a pool of money dedicated to food advocacy and food justice issues. So I hope that, I hear back from some of you and we can explore how to move forward with the agenda. We're going to have your community board maps displayed. That's sort of the theme of the summit, and we're hoping that the people who attend will identify with their board, will identify with their neighborhoods, will make friends with their neighbors, and that sort of organically turns into a smaller community board centered movement for food advocacy and food justice issues, or for the creation of a farmers market, or for a CSA, or for whatever makes sense for your individual neighborhoods. So I'll take questions if you have any questions. If anyone knows that they will be there and wants to help us or volunteer or play a role, please let me know. And I've got some English and Spanish flyers. If you could each take a few and post them in your offices, that would be helpful. Thank you.
Melissa, can you speak a little bit about the workshops?
The workshops, we've got 13 workshops in the AM session and 13 in the afternoon session. Some will be duplicated. Our food policy workshop is important enough that we'll duplicate it into the afternoon session, but others won't. We'll be discussing food deserts, lack of supermarkets, different city and state incentives for more supermarkets to come in, for bodegas to healthy, kind of give themselves a health makeover. We'll have some food demonstrations, some cooking demonstrations, some fitness demonstrations. We've got youth programming. Roadrunners is running all of the youth programming. This is a family-friendly event. Please bring your children. There won't be childcare, but if your child is 5 and above, they can certainly participate in all of the youth programming that'll go on, that'll be coordinated by the Roadrunners. Other workshops, Majora Carter will obviously speak about her urban agriculture movement. Hunger, we're addressing hunger issues. We've got Joel Berg, I believe is his name, against hunger. He's on the hunger panel. They're all listed as they get confirmed, and as panelists get confirmed, we put them on the website, so we have a nice listing of all of our workshops, and they're all coming together nicely. We've gotten tons and tons of media attention. The New York Times called us. We were going to have a press conference announcing the summit. We've decided against it. We're going to do a paper release, and we're hoping that it'll attract the media to go the day of and see and record what we've been able to accomplish, or hopefully be able to accomplish.
Okay, Melissa, are there any questions or any comments? I want to thank you for coming back again and sharing this with us. Our final presenter today is on livable communities. We have a presentation by Cydia Sherman, the Senior Planner of Municipal Arts Society. Did I pronounce your name correctly?
It's Cydia.
Cydia, okay. and welcome.
Thank you. Thank you for having me. So I'll try to be quick because I know that we have a limited amount of time. So just to introduce myself again, my name is Sadia Sherman, and I'm the senior planner at the Municipal Art Society. And for those of you who may be familiar with Municipal Art Society, I see a few familiar faces in here. Just to give you some background, the Municipal Art Society is a nonprofit civic organization. We've been around since the 1800s, and we deal with a number of issues. A lot of the things that we're known for are historic preservation, urban design issues, urban planning issues, a number of advocacy issues, public art issues. And I work in a division of the Municipal Art Society called the Planning Center. And what we do in the Planning Center is provide communities with tools and technical assistance that is useful in their planning efforts. We have a strong belief in community-based planning, and the work that we do supports that belief. So I'm here to talk about a project called the Livable Neighborhoods Program. And this is a capacity building program that we developed in 2007. And it's a 3-component program. One part of it is training, the other part is a toolkit, and the other part is a web-based network. And what the program does is trains community board members, people who are parts of community-based organizations, other people who are parts of grassroots organizations or block associations who are interested in engaging in planning. It's a free full-day workshop. And I'm going to play a brief video for you that will give you an overview of the program. So that's just like a brief overview of what our training is like. And that video was taken from our 2008 training. So I'm just going to give you a really quick overview of the program. And we have some past participants here like Fernando. And I think Xavier was here earlier. He's been to the program as well. And, you know, it's a full day of workshops. We do, if you look on at your table, there's just a little, there's a registration form and it has the course listing on it. So, you know, it's a free workshop. We have classes on zoning, on ULURP and EIS. We have courses on economic development, affordable housing, and the facilitators are from all over. We have academics, we have people from city government, we facilitate workshops as well for the Municipal Art Society. So it's a great opportunity to not only learn these things, but also connect with other people and also speak about the work that you're doing in your neighborhood and in your district. As I mentioned, one component of the training is also access to a web-based network that we have. So all of the resources that we give at the training are also online, and we have a toolkit that pretty much explains planning from start to finish. So, the beginning of the toolkit has chapters on public participation, outreach. We have some, community board parliamentary procedure. There's chapters on data and using census data and GIS. We have chapters on topical planning issues like sustainability, affordable housing, economic development. And we have some chapters on advocacy. We have chapters on 197A planning. So this is a really great tool for community boards to use in their work in particular. And it's a great tool for the community at large to have access to. This is just a map showing where our participants came from last year. And as you can see, we have still some work to do in the Bronx. We have a lot of work to do in Queens, and I was at Queens yesterday. But we have a lot of work to do in the Bronx. So the reason why I'm here today is because I really want the district managers in particular, and the council people as well, to really try to get the word out about this program. Our next training is May 8th, and registration is now open. It's a free day of training. We have breakfast and lunch, and it's on a Saturday. You can visit our website, and all of that information is on the registration forms before you, but our website is mas.org. And you can learn more about the program there. And if you need flyers, or if you would like me to send you an email that you can forward to the people at your board or in your neighborhood, I'd be happy to do so. My contact information is on that form as well, and I can also give you my card. So if anybody has questions.
Jose.
I have a question. Is it possible to have a scaled down version of your training program and bring it to our community boards, either during a committee meeting, the appropriate committee that we have, and or our general board meeting, something sort of specifically for our board members so that they get more familiar with the process and understanding of ULURP and zoning and things of that nature? Is that a possibility?
Absolutely. One of the things that we want to do is have smaller versions of this training outside of Manhattan. And we've been able to do that in Brooklyn, actually. We've had 3 trainings now. One was hosted by Brooklyn College, one was hosted by Pratt, and we have a very condensed version of this, and we had community boards, students, and people in the neighborhood come and learn together. So that's something that we want to do in Queens, that we'd like to do in the Bronx as well, and we'd be happy to work with the Borough President's office to do something that's more borough-wide. Because obviously to get to Hunter on a Saturday can be difficult if you live in the far reaches of the Bronx. So a lot of the people who come to the training are, in the South Bronx or areas that are a little closer, or maybe a little closer to Harlem or something. But I know that obviously the Bronx is a big borough, and it may be difficult to get to Manhattan that time in the morning. We have the same issue in Brooklyn and Queens as well. So the citywide training is still at Hunter, but we would like to have smaller trainings, and that's something that we'd be happy to work on.
Okay, good idea. Wendy?
I happen to agree with you that we should have one here in the Bronx. I think it's an excellent idea to train the board members, but bear in mind that the board members are volunteers, and my board, I chair community board number 6, and I cannot ask my board members to go to Manhattan. Because they're all volunteers, and Saturdays they do their things. But if it's done here in the Bronx, I'm sure they will attend. And I would not like a smaller version. I would like the whole version here done in the Bronx. Why should we have a small version?
Well, it'd be great if we had a larger version, too. I mean, part of the reason why we've had small versions is because the majority, this is something that we do out of our funding pool, which is very limited as is. So we have a citywide training where we invite all 5 boroughs to come, and it's in Manhattan because it's a more central location for the various groups that come. But if we had the funding to do a large training in the Bronx, we'd be happy to do that as well.
Okay. Fernando.
Actually, I was just going to repeat the same point. From last year, the last 2 years that I've gone, I've actually advocated for having something done centrally through the BP's office, and maybe even with the district managers or each individual board office maybe participating, so that the costs are shared throughout the community boards and the BP's office. Because I've been, like I said, this is the second year. This will be my 3rd year going. And I think this is a very powerful program for us. And I think it helps to equip us with some information that is not readily accessible through other means.
Right. And let me also add, we recognize that when new people come on the board, they don't understand even parliamentary procedure. So this would be so helpful for them to be able to segue into the role that they have committed to do. I want to thank you. I've just spoken with Tom from our office, and he's going to hook up with you, and we're going to see what we can do about arranging to have some of the workshops. And I don't want to say a minimal number, but a substantial number of the workshops here in the Bronx. Okay. Thank you so much for your presentation.
Thank you.
And I want to thank all of you for your patience and being here and helping us get through a very long agenda.